We're older patients ourselves. I'm a patient, and we believe that there are a lot of older people out there who, like myself, have exhausted all mainstream treatment options and are desperate for some kind of natural relief. For myself, cannabis works. For across a number of medical conditions, including a serious autoimmune disease that is life-limiting. It will kill me eventually.
Deb, tell me about the sort of conditions that people have that then attract them to the medicinal cannabis users group.
Pain is a big one. We have 17,000 members, and a lot of them are older Australians. We found that anxiety and depression was the highest number of people are treating with cannabis for anxiety and depression, followed shortly by pain and then cancer along those lines, yes.
So how is it taken?
Well, there are a multitude of different treatment methods. You can have the full extract oil, which is what people would take if they had cancer. You can have tinctures, you can use vaporizers, which doesn't have any products of combustion, so you're still inhaling the cannabinoids, which is very good for people with conditions such as COPD or lung cancer. You can use it topically. It's very good. Like, I have skin involvement with my autoimmune disease, and I use it on my skin. The same ointment, I also have significant arthritis that goes along with this disease, so I can use it by rubbing it into my joints, and it will take the pain away out of my joints as well. There are many different ways. Juicing, raw leaves. People with Crohn's disease find that that's very successful. It depends on, you would choose your treatment methods depending on what diseases you had and what symptoms you needed to cover.
How have the members of your group found the sort of treatment they get from the medical profession, and what help they may have in accessing this? Good, bad, indifferent?
The majority of patients can't get access. It's as simple as that. Many doctors are not even interested in speaking to their patients about cannabis. I've had someone tell me in the last few days that her doctor told her that if she wanted to speak about cannabis, she would have to leave his practice. That's ridiculous. It's absolutely ridiculous. This is legal medicine as far as the federal laws are concerned. It's only the state laws that are keeping this out of patients' hands.
So in terms of where you and other patients who are currently using it, where do you get it from?
We have to use illegal supplies. It's as simple as that. And I'm presently going through the judicial system for growing and making my own medicine. So I'll be challenging this under medical necessity through the Queensland courts.
Is it a different variety of cannabis to the cannabis that's illegal?
It's exactly the same cannabis. In fact, what a lot of people don't realise is standardising cannabis treatments is not going to work, because it's a plant and because there are over 400 different compounds and there are so many different varieties of it. It really has to be tailored personally to each patient individually. What works for you may not work for me, may not work for someone else. Even if we have the same condition, it really has to be tailored. It's like if you have 6 red roses, all of them are red, all of them are roses, but the terpenes and the compounds within them make each one of them slightly different. They have slightly different scents, effects, so the same applies with cannabis.
And everybody.
Yes, and everybody as well, yes, because everybody is different, and each of their own body metabolisms and makeups are different, and this is where it has to be tailored as well.
So in doing a tour like this, and you're getting your message out to ordinary members of the public, what's been the reaction by and large to it?
Overwhelming support, and people saying, when are you coming back? We need to bring some of our friends down. They weren't able to get here today. So I'm having to now, when I get home to Brisbane, having to plan another trip to North Queensland to start all over again. So people are desperate, and the numbers are increasing exponentially every single day.
So what do you say to people who, of course, put that view that cannabis is dangerous, that it will get people hooked on drugs and it causes untold harm to the body through things like smoking it or ingesting it?
All of those statements are completely untrue. It is non-addictive. It's not a gateway drug to heavier drugs. It's actually a gateway drug away from them. They are using cannabis to get people off. addictive drugs and toxic drugs. Smoking it is going to give you some products of combustion, but there are a lot of people who find that that's a very successful, particularly if they need quick relief for instant pain or for anxiety issues. Others find that vaporizers aren't quite enough, yet the smoking a joint does work. It shouldn't be frowned upon. They have done studies to prove that cannabis does not cause lung cancer. It's actually the tobacco that causes lung cancer in most cases. Yes, there'll be the odd person here and there who's never used tobacco that will get cancer, but you can have people who've never been in the sun that get sun cancers. So it's really about the individual. Cannabis has been demonised for so long. This is why we're doing these, to try and to get accurate information from patients who are living this every day. And it's not just that I'm a patient. I have studied, I've done a cannabis course online, a physician's course. I have studied it as well, mainly so that I knew how to treat myself. The pharmaceutical drugs weren't working. I exhausted all mainstream treatment options. One of the last things I had was called a prostaglandin infusion. That was supposed to give me 4 to 5 months relief. It's so harsh that they can't even pump it into a vein. I had to have a PICC line inserted so they could pump it straight into my heart. Instead of giving me any relief, it escalated the symptoms 50 to 100-fold for the next 6 months. I was at the point where I didn't know whether I could keep going. And that was when I accidentally stumbled on the MCUA and found out about cannabis oil, because I didn't know about cannabis oil, and I'd found that it worked, without all of the debilitating side effects. I'm never going to get any better. This is going to get progressively worse. I made the cannabis oil at home, and from the very first dose, I had symptom relief.
So is this your life's work now, to see cannabis legalised?
Yeah, I need it legalised. I need it legalised so that I can treat without having to go out and do all of these talks and fight the government to make it legal, because all I want to do is go home and heal, or at least try to get this condition into some form of remission for a short period of time. I'm tired. We've been fighting this for a few years now, and it's mostly patients who are at the forefront of this. I feel like if I'm not going to fight for this, how can I expect anyone else to do it for me?